going to the wind-ups just after past. Esther McVey.
Thank you, Mr Deputy Speaker. I want to thank the member for Liverpool Walton and congratulate him for bringing this debate here today, and also the member for Chatham and Aylesford for co-sponsoring this, because this debate has been deeply distressing listening to the stories that have been told here. Human beings have rights. They have the right to education, the right to healthcare, the right to body autonomy, the right to equality, and the right to a private family life free from government interference, to be able to spend time with their loved ones. And it is a sad fact that all of those rights that I've just listened came under attack during COVID lockdown. But we've moved on from lockdown and COVID restrictions have ended. So it is deeply harrowing to discover that for some that is not the case. Stories we've heard today, stories from my constituents, and also it was highlighted in the weekend in the Sunday Times. And I am horrified that 7 months after the removal of official restrictions, care home residents are still being denied visits from their families and friends. It needs to be mentioned too that some care homes are open and allowing visits, but others are not, and continue to stop family members seeing one another, which is simply inhumane. Beyond cruel, isolation and loss of social contact has a devastating impact on physical and psychological health. Without the support of family and friends, health outcomes are poorer as residents lose hope, sometimes even losing the will to live, often refusing treatment. And for residents with dementia, it is especially devastating as they don't understand why their relatives haven't been to see them. Many also have serious sensory impairments, and for them, physical touch and communication with family members might be all that they have left. And I'm more concerned that this situation is concealing neglect and abuse. As co-chair of the All-Party Parliamentary Group for Pandemic Response and Recovery, I've heard from campaigners back in April and more recently who warned of widespread and shocking safeguard issues involving medication, hydration, hygiene and the lack of basic care. Families must be allowed full access to support, protect and advocate for their loved ones when they need it most. What can be done to end this unnecessary suffering once and for all? It is now beyond urgent that care homes, local authorities, UK HSA and the Care Quality Commission stop blaming each other for these appalling failures of policy and take action. Rather than requiring new legislation, we need to uphold existing laws. Article 8 of the Human Rights and the Mental Capacity Act, and should have protected against this situation ever arising. Instead, this legislation is being willfully misinterpreted as an excuse to keep people isolated in care homes, and sometimes they feel as if they're prisoners. So I call upon the Minister to get tough on any care homes that block residents from seeing visitors. There should be severe consequences for those who continue to blight the lives of those in care, and they should face some kind of fines or legal action. We are failing vulnerable members of our society, and it is simply cannot be allowed to continue. We must end all unlawful visiting restrictions and stop this unnecessary suffering and neglect. It is deeply shameful and a stain on our history that our country has allowed this to happen, and is so long now happening after COVID restrictions have been lifted. Some care homes say these restrictions are due to staff leaving the sector when mandatory vaccinations were called into use. And can I ask, therefore, what the Minister and what the government is doing to get those staff back into the care homes, back into those jobs? Could have been up to 7% of staff from care homes that were lost. That's 40,000 employees. So what's the government doing to reinstate them and compensate them for losing their job? As Professor Robert Dingwall told our APPG at the inaugural meeting last year, a good society is defined by life, health, liberty and the pursuit of happiness, not by the prevention of one single disease.
Maria Eagle.